Right now we are working with a grant to provide diabetes education. We have a wellness center that we're tracking a group of patients trying to lower the hemoglobin A1C. I've recently gotten some education material in Spanish, and just educating the people about how their disease it can be treated, getting education to them by that. We had a set of doctors here that was here about, over 30 years, and so they had established clientele and they had patients that were set in their ways, and so when we started bringing in new providers, we had to accommodate them, and we have to go the extra mile to bring them in, because they don't have a choice of going across town to the other hospital. They have to, if we don't reach them, they won't come back, and so that includes the whole family. So we have to be very, very aggressive in trying to address their needs and customizing their care, education, outreach, everything like that. My family, and I grew up in Menard, and this October I'll be here for 35 years. So I'm passionate about healthcare. I'm passionate about bringing healthcare to the people that are living here. And the trip to San Angelo, yeah, it's only 46 miles, but if you don't have a car, or if you can't drive and you can't see in your healthcare, you have to depend on somebody, and you don't have somebody. The rural transportation is real limited here. We don't have any problem hiring someone. We have someone committing to us, making that commitment. By the time people come looking for us, they're ready to get away from Dallas or not. We had one doctor recruited that we had, and his wife just wasn't ready to live in the country. And so it didn't work out. The big problem right now, or the issue that we have, is that we need to educate more people to taking care of the older people, the geriatrics. Certain sections of the nursing home, they require it to have a certified nurse's aide. I think that the last statistic that I read is the median age for a nurse is like 58, and we have nurses that age, and we need younger nurses. It's a hard work though, it's not a 9-to-5 job, it's a 12-hour job sometimes, and it's really, we need to find people who are passionate about healthcare. That's the key to keeping nurses in the business. I was on the board, I worked for a while for Garza Healthcare District, and so I was on the board of the Permian AHAC, and then I was on the Big Country AHAC. It was a good experience. I learned what other schools were doing. Unfortunately, I wasn't ever able to get that to our school. I have tons of the book, The Hot Jobs. It's a good program. To educate the high school kids with health careers starting earlier than the senior year, and I'd like to see a nurse's aid training or a first aid training in the high school, having a health fair that we plan a year and ahead of time and bring in educators and have it in the gymnasium or somewhere right there where we have a captive audience. It's been a few years since we've tried to do that, maybe 5 years or so, so it's time. One of the things that we had a few years ago, we partnered with Angelo State University, and we had a program that was a LVN to RN program, and that was really a good program, and I'd like to see that happen again. Oh, I'd love that. Yes, I'd love that. And I know that some of the nurses here and the administrator and some of the other department heads would love to do that. The children that or the students that have parents in healthcare or have parents who have a college degree, they're easier to get their information to. They know that they need to take their ACT. They know they need to take accelerated math or biology. They know that. But it's the ones that don't, that need to be cultivated. They need to know that you need to take your sciences, you need to take your maths, you need to do good, you need to show interest in what you're doing, so that you get that letter of support from your counselor or your teacher. You know, they don't know what they don't know. And doesn't mean anything other than that we need to help them rise above that, because they may just be the best nurse that you would ever have gotten. Having familiarity is someone in the community that can be trusted, or that they know they're going to try their best to get them in. So whenever I have someone coming in with their little paper that they got or their envelope, I stop what I'm doing and let them know that they're number one.